It's another Wellness Wednesday segment here on Mix 94.7 KMCH. And today we are going to talk about something that really, truly affects all of us: stress. I'm with Karen Schmitz from the Behavioral Health Clinic at Regional Medical Center. And first and foremost, Karen, thank you. Thank you for coming in and talking to me today.
Thank you for having me. I really appreciate this.
Stress is inevitable. As I said, we all have stress. But I mean, look at me. Moving, finding a new house, trying to find my wife a new job, the stress of getting all that. But we handle it differently. I can roll with the punches. My wife, it's much more traumatic. I mean, what are some ways that stress really affects us?
Well, stress really affects everyone, but some cope more effectively or recover just more quickly than others. Physical and mental health can both be affected. Identifying your cause is really important. Are you having sleeping issues? Maybe an increase in alcohol or other substances? Are you more irritable or quick to anger? Maybe your stress affects you by making you feel more depressed or tired, just fatigued. Stress affects us all differently, and it is important to know what your stress response is in order to adjust. Long-term stress can harm your physical health by suppressing immune, digestive, sleep, and reproductive systems, possibly causing them to stop working properly. Chronic stress can also make us more susceptible to colds, viral infections, headaches, and the like, as well as brain health issues such as depression, anxiety, and insomnia.
In my household, we have learned a technique that we call the curtain or the kitchen. And if I can explain.
Absolutely.
If you have a fire on the stove, you can put it out yourself. If the fire is on the stove and ends up on a curtain, you could still put it out yourself. But if you walk in and the kitchen is ablaze and the house on fire, you can't put it out yourself. So oftentimes, if my wife and I are seeing the other getting stressed, we'll look at each other and say, is it a curtain or is it a kitchen? We know the tools and the things that we need to do to help each other. But what are the other healthy ways that you can help to minimize or reduce your stress?
Well, first of all, that's a great technique. I love that you shared that because that really helps people realize how grounding is important. It's important to become in the moment. Using healthy coping mechanisms are important for long-term reduction of stress. Regular exercise, 30 minutes a day of just walking or doing something can help your overall mood and reduce your stress. Try a relaxing activity such as yoga, meditation, or even just a simple walk. There are great meditations on YouTube or various apps. Is putting a puzzle together relaxing for you? Maybe it's baking or talking with a friend. Be mindful, be aware of your senses. There is a technique called 5-4-3-2-1, similar to the one you use, where it's just bringing you to the present moment. You think of 5 things that you can see, 4 things that you can touch, 3 things that you can hear, 2 things you can smell, and 1 thing you can taste, or even one good thing about yourself. And it brings you to that present moment. Schedule time daily to do what's relaxing for you. If you don't, unhealthy ways to cope can happen. These include suicidal thoughts, feelings of being completely overwhelmed or unable to cope at all, or the use of alcohol, drugs, or nicotine, including vaping.
You mentioned scheduling a time. We do it on a weekly basis. We have what's called a quiet time. We tell the girls, we're not going to use the tablet. We're going to shut off the TVs. We want to be able to play with you, play with your toys. We can read books. It seems to have a beneficial effect for everybody, not only us as parents, but the kids too. Because remember, kids can suffer from stress as well.
Absolutely, they can. And in our society right now, with tablets and social media, our kids are facing challenges that we never even dreamed of.
But we should say that not all stress is bad, that there's good stress and bad stress. But how do we keep the good stress and avoid the bad stuff?
Right. And not all stress is bad. Think of 4 A's: avoid, alter, adapt, and accept. Avoid situations, things, or even people that can cause you a lot of stress when you can. Alter your response and attempt to make it better. Ask people to change their behavior. Communicate your feelings openly. State limits in advance and manage your time better. Accept that some things are just how they are. Talk with someone. Your feelings are valid, even if the situation itself cannot be changed. Forgive. It takes energy to be angry. Practice positive self-talk. Don't lose objectivity and create a negative avalanche. It seems like once you go down that path, you can't crawl up very easily. And adapt. Change your standards or expectations in order to cope long term. Stop the negative thoughts. Look at the situation from different angles if you're struggling with something. Adopt a positive mantra. I have been encouraging my patients to use I am statements. I am strong. I am healthy. I am stronger than my disease. I am willing to make changes. I am willing to put in the time. Put things into perspective. Create a list that bring you joy and look at the big picture. Will this particular issue matter in a year from now, 5 years from now? Will it even be a thought? And keep practicing. Change takes work, but we can all do it. Look at me. I'm on the radio talking, and this is not my comfort zone. I keep encouraging myself to go outside my limits. If you have any questions or are struggling, please contact your provider at Regional Family Health, and we would be glad to give you more resources.
Well, I'm glad to have this conversation with you, Karen. And again, stress is one of those things that we have, and so many people want to push it aside. And then when it does turn into a house fire,
we can prevent the house fire
if we just know it ahead of time and identify it. So thank you. Yes. Thank you so much.
Thank you very much.
Karen Schmitz with the Behavioral Health Clinic at Regional Medical Center, a part of our Wellness Wednesday here on KMCH.